everyone this morning. One of the things that Nadia did mention is in the health survey, we asked for health symptoms in general, and then we asked for the frequency of odor events and where they thought the odor events were coming from and the health impacts associated with those odor events. So that's sort of where I'm going to take off at this point. So we're now down to what kind of prescription do we have to change to protect and improve public health. And if you work with any of the health agencies, we've sort of gotten a really pushback from the health agencies. So it's obvious that it's up to the environmental community and the NGO community to try and document the health impacts and associate them back to the exposure, and then Calvin will be talking about the testing. So one of the things we want to point out that you need to identify the sources of the health impacts and the routes of exposure. So you need to start looking around, seeing what's in your community. Most of you know what's there. Checking out the wind speed direction to determine which facility it may be coming from, and document that as it corresponds to the health impacts. Then you need to organize to address the sources of pollution, because frequently the community will complain that they're very, very sick, and they want someone to come in and help them figure out where it's coming from and what they can do to address it. And then monitor the pollution in the environment. And again, Calvin will talk more about that. Nadia talked to you about we did air and water sampling and correlated the chemicals and the health impacts back to the symptoms the community had. And then evaluate the facility's operating conditions and events. You can get documents from the state agency, whether it be the environmental agency or the oil and gas agency, and it will have things that they are required to report, like we had to bypass, like we had to flare, and this is how long we flared for. And then there are what are called upset and accidental releases that they are required to report. Depending on the quantity they release, they're required to report it to the local emergency planning commission in the county, and then they're reported to the EPA, and then the national response team. And then you need to correlate those reports to the health impacts and those associated with the chemicals present in the environment. And Nadia and I will be glad to help you, teach you how to do it, so that you can come up with this information. You want to know where to get the health impacts from the New Jersey fact sheets or the Agency for Toxic Substance and Disease Registry has by chemical all the health impacts. And then you need to consider biomonitoring of the exposed populations. Blood samples, urine samples, and that was actually done in Calvin's community. And the agencies did one evaluation, and then I did another, which came out with considerably different results. But biomonitoring is something that is expensive, so when you go to that, you need to be sure what chemicals you want to test for based on what chemicals are present in the environment. And then you need to document those impacts that pollutants are having on the health of the community. And you will frequently find out that there are a lot of people with issues and concerns, and then there's a part of the population that, quote, doesn't want to get involved, but will talk to you privately about what's they're encountering, but, oh, my husband works for the industry, or my husband works for the agricultural community, and we can't speak up. So you want to engage the people who you usually engage, but you want to also not forget the other people who are not able to speak out. And then all of this leads to a reduction in exposure. You have to identify the exposure and then work towards reducing the exposure and interrupting those drops of exposure. And you can do that by going to the companies and showing them the data you have, and they will push back on you, but suddenly you find out that they're starting to be more careful because they know you're documenting. And when we go into an area to do monitoring, if they know we're coming, you'll see the compressors not working those days and various things. Calvin has that in his dish. You know, you just make sure the compressors aren't on that day, and when they come into your community, everything's fine. And then you get the information out to a broader audience. And by broader audience, I mean like the government agencies at the local, state, and federal level, like the industry. As many people as you can get that message out to is critical, okay? So how do you educate vulnerable communities? And I'm sure all of you have vulnerable communities that you work with. You identify how the community is impacts of different chemicals, pollutants, and stressors. These communities are asking for your help. You have to be able to work with them and give them the information they so desperately need, like the number, severity, and widespread impacts of physical and mental health, and how it impacts their quality of life. Again, it's tough to do mental health impacts because people don't want to divulge that information. But over time, if you insert it in questionnaires and things, you'll start hearing from people quietly, and you just be sure you don't identify that person to the broader community. You provide health and scientific information to enable the community members to understand the factors and also to encompass that into what's going on in their community. You're helping them make it fit with what they're doing in their community, and then you allow the community to integrate it into their specific situation and let them develop the community strategies. If you go in and say, this is how you address it, it's your strategy. You want it to be the community strategy. And this allows the community to educate government officials, elected officials, business owners, healthcare providers, and the general public about their specific situation. And they have to be the messenger. Don't make the tripping up that you become the messenger for that community. They have to become the messenger for their own situations. And you let them take measures to reduce their exposure, to improve health and their quality of life, reduce their risk, recover, and become more resilient. So how do you help communities identify exposure and plot strategies? You document the odor events. You have them describe the smells they're encountering. You record health impacts that they experience in the length of time. These are all the things we have in what we call the odor and symptom log. And Nadia said that Earthworks will put the odor and symptom log on the website if you want to download it and use it in your community. You list the number of individuals in the household that were sick. Is it always mom getting sick? Or when there's a bad event, is it the whole family getting sick? And then you record lost work time, because then you can start looking at labor situations. You track the impacts on animals, that your pets, your livestock, or any wildlife that you may see in the area being impacted. Identify the source of the odor event as best you can. Note the date, the time, duration, and the location of the odor event. And then go to your TV weather channel and get the wind speed and direction. Because the industry will say, you couldn't have been impacted because my facility in the wind was going this way and it could not have possibly gotten to you. So what are the benefits of odor and symptom logs? I can't say this enough. If you don't document an odor event, and if you don't report it, it doesn't exist. So you can sit here and tell me, over the last year you've had 2,000 odor events, and I said, did you document it? And did you submit it, a complaint to the agency? And if you say no, they didn't exist. You need to document it, and you need to call in. Immediately ongoing documentation of the event and associated health impacts. And that's what the odor and symptom log has. The odor, and then the health impacts. A record of how frequently. So I don't care if you have different odor events 3 times a day. You need to fill out this 1 or 2 page odor event so you will have it documented. Supports possible correlation with the chemicals. After you've documented it, you can go to the agencies, which I'll talk about in a minute, and see what kind of event is going on at a facility near you. You need to support possible correlations with those chemicals and the information to determine if, when, which health symptoms were experienced. If you had a headache this morning, as Calvin said he does, but this afternoon you had a sore throat, were there 2 separate events that gave you the headache this morning and sore throat this afternoon? Did you fill out 2 odor and symptom logs? I don't think Calvin needs to fill out 1 for his headache. And then you need to look at the information that's submitted to the local, state, and federal agencies. The local at the county level is the Office of Emergency Response, and the industries are required to submit that data. Lately, Sharon has gotten some data that went to the Office of Emergency Response, and it correlated really well with what the citizens were experiencing. And then you need to go to the state agency that requires the reporting. In Louisiana, it's state police, but in each state it's a little different. And then if it's a really big release, go to the National Response Center. All of those are available on the internet. A lot of the poor communities don't have internet access, but you can pull it down for them and walk into that community and say, you had this big event. Did you have an odor event? Did you fill out an odor and symptom log? Look how much chemicals they reported that they released. So correlating odor events with accidental releases. You check with the agencies, the ones I just mentioned. You determine and list the health impacts of the chemicals that were released, that were reported to those agencies. You identify association with the health impacts that the community is experiencing and documenting. And then you use the data from the accidental releases to determine which chemicals to monitor in the air and the water. Calvin can go into your community and he says, tell me what you know. And if you haven't documented what kind of accidental releases, reporting, or what kind of emissions for the facility, Calvin doesn't know what to test for. If you have that information, Calvin can then sit down with the community and say, well, based on what data you have, it looks like this is what we would start with to see how it works out. And you build a case to request the government agencies provide ambient monitors, because Calvin can help you with a sample or two, but then in the long run, you want the state agency to come in and do regular monitoring. And Calvin and his work in DISH got ambient monitoring going on that was on the internet. You could go on if you had an odor event and see what that monitor was coming up with. And then you can require the state agency to require in the permit of that facility that the permit conditions require them to do ambient monitoring and that that data be made publicly available in real time. Okay? So when you conduct health surveys, one, you do it before the activity starts, and I know that's impossible in a lot of your communities. But in new areas where shale gas or where industrial facilities, we talked this morning about South African Sasol, that's coming to a number of communities in the United States. You want to do the health survey before the facility is there. Then, after the activity is underway, so you identify the direct impact of the industrial activity. And then if conditions change, if it gets really worse, as it did in DISH, then you need to do additional surveys. Ongoing odor and symptom logs you need to do all the time. So you can track what's going on at that facility and the impact it's having on the community. So this is one of my ongoing projects at this time. This is Bayou Corn, which is a sinkhole that developed next to a salt dome that had a cavern that was a brine leaching cavern. And the cavern was down more than 6,000 feet deep, and it was too close to the edge of the salt dome. And it caved in from the side, and when it caved in from the side, the sinkhole developed. This happened August the 3rd, 2012. The community was the community of Bayou Corn in Grand Bayou, 150 homes, 350 individuals. Mandatory evacuation on August the 3rd. Not all of the people left. Most of the people come back at least once a day to check their property. And it is an absolute nightmare for that community. They have not been in their homes for Thanksgiving, for Christmas, and they won't be in their homes for Easter. They were complaining of health impacts, so we developed an odor and symptom law with Louisiana Environmental Action Network that I provide a lot of technical assistance to. We put it on the website, and so when they have an odor event, they can immediately go fill it out, hit send, and I get it on my computer. So 84% of the individuals who reported odor events reported associated health symptoms. We didn't have a pre, because again, we didn't know the sinkhole was developed. But here you see the symptoms they reported. Headache, 68%, sore throat, 53%, nose irritation, burning, watery eyes, fatigue, mood change, coughing, nosebleeds, skin irritation, sleep disorders, lightheadedness, behavior upsets. And what happened is that a formation on the side of the salt dome that contained natural gas and oil migrated to the surface, so the sinkhole is full of crude oil and natural gas bubbling up in the sinkhole, as well as all the bayous around there. And for 2 months before the sinkhole developed, there were earthquakes in this community. So they are being exposed to this crude oil and this natural gas bubbling, and these are the health impacts. Next. So then the community started complaining more so when the agencies notified them that they were going to be cleaning out all the debris in the sinkhole that was loaded with crude oil. So they said we're going to remove the crude oil and vegetation debris from the sinkhole, and that odor events occurred on a more frequent basis. We were getting them on a daily basis. They were also taking the crude oil out of the failed cavern, which is filling up a foot a day and driving this crude oil up to the surface. But look what happened. Before, we had headaches at 63%. During those removal events, we had headaches at 82%. Nose irritation went from 19 to 64%. Burning and watery eyes went from 19 to 55%. So here we were able to capture the increase in health impacts, and at the same time, the State Department of Environmental Quality was monitoring the air for volatile organics. And when I was able to capture that data, as soon as they put it up, there was an increase in volatile emissions in the air. So clearly, it's a cause and effect, ongoing, and then a cause and effect when they started cleaning out the sinkhole and the caverns. And on Monday of last week, I co-chaired an EPA hydraulic fracturing work group, which is part of the EPA study on groundwater being impacted by hydraulic fracturing. And that one was analytical methods development. And what we were looking at is, are the analytical methods that are now on the books adequate to evaluate what's going on with fracking fluid and with flowback water? Or are there needs for additional analytical methods to be developed? And, you know, when you sample water versus you sample the scoopy fracking fluid or the scoopy radioactive flowback water, do those same methods work? So in the analytical regime, there's a lot of work going on with EPA and with the industry and with lab owners and all of the people at the state agencies. So bear in mind there's a lot of work going on, but it only happens if the community pushes. Calvin?